everyone. Today's topic is 18 sectors in healthcare industry. So if you are a medical student, nursing student, paramedic, dental, or if you are studying in any of the streams, commerce, arts, science, etc., and you are looking for your career into a healthcare, any of the different fields, so this video is for you. Even if you are working any of the healthcare sector as a professional, I'm sure you have not looked at the healthcare industry in a way where all different 18 sectors available in the healthcare industry. Let's see the overview. I'm Dr. Sandeep Patel, founder and CEO at Docthub. So healthcare ecosystem has stakeholders from different sectors, we know, and they all are contributing to the people's healthcare service or healthcare impact, or directly or indirectly, and each of this sector has its own dynamics of business format and operational formats. So let's see what all are these 18 sectors. One, obviously the major sector which directly working with the patient care is hospital. Second, public health, healthcare NGO. Fourth, academic institutes. Fifth, health insurance. Sixth, healthcare IT, blood and tissue banks, diagnostics, medical devices, pharmaceuticals, retail and distribution sector, home care, alternative medicine, research organization, healthcare consultancy, digital health, long-term care and hospice, and last, healthcare publication. So let's see the brief of each of these sectors. So hospital, we might have visited different hospitals, but as per the facilities the providing by the services provided by hospitals, there are different types of hospitals we can categorize. One is primary health center, which we usually observe at a village or a periphery centers as a part of government system. Secondary care general hospitals. Small healthcare setups, these are 20 to 40 bedded hospitals with 2 or 3 clinical specialties. Nursing homes, usually it is run by gynecologists for the obstetrics work. Specialty centers like dedicated pediatric hospital, dedicated orthopedic hospital, dedicated kidney hospital, etc. Tertiary care hospitals, full-fledged multi-speciality hospitals under one roof. You get everything in and out, all the clinical services. Community health centers. So in a government system there is a primary health center, PHC, and the sub-taluk level there is a community health center. They run by under a doctor only, but next level of PHC we can say it's a community health center. And after that, next is occupational health centers, OHC. These are based at factory or any manufacturer unit, which for their employees there is a health center who are looking after employees' health and wellness. And last is the short stay surgical units. Mostly you observe it in western countries where there is dedicated units for the surgical short stay surgical units. So next sector is public health. Usually in a public health there are stakeholders of every country. They have a ministry of health, there are government departments and agencies who are looking after execution of different laws and policies. Government health schemes also a part of this sector. Government health initiatives, there are different programs, maybe like related to nutrition, child care, women health, vaccination, different programs, and these programs run by particular department and agencies. Public health organizations like WHO, UNICEF, Red Cross, these are the independent NGOs, independent health organizations looking after global globally they are working for the healthcare of the community. Disaster management centers. In that centers, it's a part of public health administration, and they also have a health team. Next sector is healthcare NGO. So non-government organization NGOs run by different corporates under their CSR activities. They also do healthcare initiatives. There are charity trusts or foundations working for the health awareness in a community. There are associations, professional bodies of different specialty. These are the representative body of different healthcare professional fields. Like in a doctors, there are orthopedics association, pediatric association, cardiology associations, like that. There are nursing professionals association, there are paramedical associations. And fourth is the patient support groups. There are different groups with a particular disease or particular types of clinical conditions. They are working for the patient awareness and support. For example, there are cancer care groups at a national level, at a state level, even at a city level. There are cancer care groups also. They support cancer patient for they are working for the awareness, providing them resources. Like other groups are like for the anemia, Alzheimer disease, mental health groups. Also they are working for the betterment of the patient life. Fourth sector is academic institutes. So these institutes includes, there are dedicated health science universities. They affiliate healthcare courses in different colleges and institutes. Educational boards, they give recognitions to the institutions. They define the curriculum guidelines for the different academic courses. They also provide certifications. Professional licensing authority, these are statutory body who issue practicing license to the professionals. They also define professional ethics, practice regulations. So in India there is National Medical Commission, Indian Nursing Council. In United Kingdom there is General Medical Council, GMC. So like that, every country has their own statutory body for different professionals. Government quality councils, like in India there is Quality Council of India, who has a NABH program, like National Accreditation Board for hospitals and healthcare providers. They give accreditations to the hospitals, diagnostics, clinics, etc. They define quality standards, give accreditation and certifications. Then teaching institutes and colleges, like medical colleges, nursing colleges, paramedical colleges, pharmacy colleges, physiotherapy colleges. They also, in this sector, it's a majority of the area in that part. Healthcare training centers. So there are dedicated healthcare training centers who work for, they may be academic wing of particular different associations. They are also skill centers and training agencies. Fifth is health insurance sector. Usually there are government insurance regulatory body. In India there is Insurance Regulatory and Development Authority, IRDA, who recognizes the insurance company, give registrations and the norms for, define the norms, rules, guidelines for the operations of insurance company. And these insurance companies, they issue health insurance policies. There are also third party administrator, TPA companies, who are not issuing the insurance, but they are involved in a process of claims and the reimbursement of the amount to the patients and all. There are cashless tie-ups with the hospitals, and insurance doctors are also part of such health insurance, who are involved in a medical audit, claim document verifications, etc. Sixth sector is healthcare IT, information technology. So it includes hospital software, clinic software. There are web portals like Docthub.com, who provide the different, which is an aggregation platform for healthcare professionals in jobs, courses and events. So also the health insurance TPA software companies. There are healthcare data registry portals. So anything related to web services or information technology, it includes in the healthcare IT field. Seventh, blood and tissue banks. So blood banks, there are stem cell bank, skin bank, eye bank, sperm bank, cord blood bank, neurobio bank, tooth banks. They also known as dental pulp banking, musculoskeletal tissue bank, genetic tissue banks. So these are different types of banks nowadays. Some of are not yet, you will not observe in India, but in Western countries, in US, UK, you will observe like genetic tissue banks or musculoskeletal tissue banks, etc. Neurobio banks. These are in a developed country. It is nowadays the dedicated centers they are working for in particular field. 8, diagnostics. So different diagnosis, like we know the pathology labs, microbiology labs, radiology imaging centers. There are satellite blood collection centers, and there are nuclear diagnostic centers like PET scan or nuclear scanning included there. 9th, medical devices. In this sector, there are radiology equipment manufacturers, pathology equipment, critical care ICU equipments like emergency, defibrillator and ventilators, etc. OT equipments manufacturing, dialysis machines, anesthesia equipment, endoscopy and laparoscopy instruments and equipment manufacturing companies, ambulance fabrication work companies, hospital furniture companies, surgical instruments companies. 10th, the pharmaceutical companies. So pharmaceutical manufacturing, it includes also nutraceuticals, dermaceuticals, pharma packaging companies, biotechnology companies. Usually pharmaceuticals are 3 types of companies. One is formulation manufacturing. Second is API, means active pharma ingredient manufacturing companies. And third is contract manufacturing companies. So there are 3 different categories. 11th sector is retail and distribution. So in this sector, there are retail pharmacies, the pharma distributor, medical equipment dealers and distributors, hospital furniture dealers and distributors, and other healthcare enterprises who are in the part of the supply chain, basically we can say. 12th is home care sector. In this sector, there are home nursing care, home physiotherapy care, home medication, also the home consultation. Usually the general physician visit to your home and for the general checkup or assessment, and then if further required, he shifted the patient to the hospital. There are post-operative care at home, and the care assistance for to the old age people at home. If they want a care assistant, there are agencies who provide care assistance. 13, the alternative medicine. So there are many alternative medicine, and in this sector, each of these alternative medicine has a different role in a healthcare system. So there is homeopathy, Ayurveda, Unani, yoga therapy, naturopathy, Reiki therapy, Sujok therapy, music therapy, magnetotherapy, acupressure, acupuncture, herbal medicine, hypnotherapy, electropathy medicine, massage therapy, Bach flower medicine, balneology, and chromotherapy. So in each of these alternative medicine, there are different courses available of a bachelor and master's types of courses. You can search on courses.docthub.com, our portal. 14, the sector is research organization. So there are clinical research institute, like in India there is Indian Clinical Research Institute, ICRI. There are public health research institute, vaccine research centers, biotechnology research institutes, genetic research centers, bioproduct research institutes, contract research organization, CRO. Generally the CRO are working with the pharmaceutical companies after any of the research product of pharma product. They do the clinical trials and patient data registry organizations like organ waiting list for the transplant patients, like bone marrow registry centers, etc. 15th, healthcare consultancy. In this sector, there are different types of professionals, and the agencies are working for different particular professional work like quality accreditation consultancy, healthcare planning and designing, healthcare equipment consultants, medical gas pipe system consultants. There are OT and HAVOC project agencies, healthcare recruitment agency, health technology consultants, bioproduct design consultants. There are course recognition consultants. 16th, digital health. In this sector, all the technology initiatives, technology availability for the patients which empowers them, like telemedicine, health variables, like we are wearing the smart watch and it collects the health data and you can track it with your mobile application. Health record mobile app, you can store your reports, your prescriptions, etc. So there are many mobile applications for the patients. Healthcare device mobile app. So any particular device like a glucometer, or there are devices which record your ECG, you can track and save your healthcare data into a mobile application. So there is it has an integration, that particular device and mobile application. Diagnostic device mobile application. Online pharmacy, we order online pharmacy, that all mobile application or that platforms, they come into this sector. And online lab test we order through the mobile apps, that also includes in the digital health. 17, there are long-term care and hospice. So it includes old age care homes, long-term nursing care centers, hospice. Hospice are the specific centers for the care of end of life for the patients who are at their end stage of cancer. They only need nursing care, and to ensure that their life could be as much as pain free, so they provide the basic nursing care and the counseling and etc. Mental care homes and disabled care homes, so this includes in that part. And last, there are healthcare publication. So it includes, there are medical journal publications, healthcare magazines, clinical guidelines and protocols which are published by professional bodies, different associations and institutes, medical books publication house. There are patient awareness booklets, manuals and handbooks. So in this sector, if you are keen to go for the journalism, the medical journalism, content writing in a healthcare field, or the printing and the digital publication kind of work, if you are looking for, so in this sector you can explore your opportunities. And that's all for this topic. And if you like this content, please hit the like button so that YouTube can recognize our content and it can reach to the as much as the healthcare professionals. And comment below which sector you want to know more about it, and please like, share and subscribe. Thank you very much.